Let me start off by thanking the legal team and the witnesses that presented in front of Judge Parker. I truly believe the work that they did will save lives, and it will lead to less infections and less people having the heartache of a serious case of COVID. So thank you from the bottom of my heart, not only as a county judge, but just as a parent and as a person for the work that you did. I am very pleased with the court's ruling. It means that the order that we have in place will remain in effect. It means that schools in Dallas County are required to have a mask policy. It means that businesses in Dallas County are required to have a mask policy. And it means that you'll be required to wear a mask in our county buildings. The court found that there is a probable right to winning the case on the merits, and therefore the court entered this temporary injunction against Governor Abbott and the state in impeding our ability to have these mask requirements. But I want to also point out that this is not although this is a court victory, it's really not a victory against a person or an entity. It's a victory for humans who live in Dallas County against the virus. We should not personalize this as us against them. It is all of us against the virus, not the vaccinated against the unvaccinated, or the Democrats against the Republicans, or the pros versus the cons. It's really all of us working together to follow our generals in this battle against the virus. And the generals are the medical doctors who are studying this virus and who are trained to understand what we need to do to keep ourselves and our families safe. One of those doctors who testified at the hearing is with us today. And I want to turn it over now to Dr. Septimus to talk to us about the importance of masking and share his thoughts. Doctor?
Well, Judge, thank you so much. It was really an honor to be asked to help testify yesterday in Dallas County. What I explained to the judge and the people in the court was that we still have 30 to 40% of our population that go unimmunized at this time. And certainly the long-term solution to ending this pandemic is to get as many people vaccinated as possible. And even if we were to do that in a period of a week or two, it would take 2 to 3 months before we got sufficient immunity in our population to begin to reduce the spread of this virus. So absence of that, we have to revert back to what we call non-pharmacological interventions. And the most effective and the most well-known of that are the use of masks. Masks certainly reduce the spread of COVID, especially with this new Delta variant, which I'm sure all of you realize is more transmissible than the prior strains that we had to deal with over the last year and a half. And so it's essential, if we want to cut down immediately on transmission, that we implement masks for everyone in public spaces, indoors, where social distancing cannot take place. It's the most effective. It costs literally pennies for these masks, and it's the most immediate thing that we can do. And the big picture really is that we want to make our community as safe as possible for everyone. And I realize that I think we all take personal responsibility, but we realize through history that for us to get to the level of masking and vaccination, it's going to take probably more than just cajoling people. We unfortunately have to go to mandating in order for us to get to a sufficient level where we can slow the transmission of this virus and protect lives. The other thing that I mentioned yesterday that some people only think about, potentially the number of people that are in the hospital, the number of unfortunate patients that may die of COVID. There are many other unintended consequences of this virus, such as the stress to the healthcare system, people with chronic diseases delaying getting treatment, the number of domestic violence cases, the number of suicides in teenagers and others. We've had more deaths from teenage suicides because of the social problems that have occurred through this pandemic than have actually died of COVID. So it's much bigger than just COVID alone. And the best way to reduce transmission and try to get things back to closer to what was normal, at least short term, is to implement masking.
Thank you so much, Doctor. And there's going to be an opportunity to ask some questions. We are going to need to wrap up a little before 3 because I've got calls with school superintendents and just back-to-back things. We got people with areas of expertise on the call to answer questions beyond just those who are speaking. But the last person I wanted you to hear from before we answer questions, because I think people can get wrapped up in the legal fight, if you will, or in some argument between people who think they should be vaccinated or not be vaccinated or whatever. But really, this gets down to real human beings and what is happening in the real world. And so I wanted you to hear, we got to hear from Melissa Griffith yesterday, and I wanted you guys to be able to hear from Melissa. And so Melissa, if you could just share a little bit of your story and that of Ellis.
Sure. Thank you, Judge Jenkins. My name's Melissa Griffith. I had the pleasure and really the honor of having the opportunity to testify yesterday. And I just wanted to thank the legal team again for giving me that opportunity to speak on behalf of the moms who were able to be a part of this lawsuit, because every single one of the moms involved, every single one of the families feels, just as strongly as I do, of course, about their children. And I was the mom who had the opportunity to talk. So my daughter, her name is Ellis, and she has a rare genetic disorder called RTD that has affected her, really her entire body, and has left her with some profound physical disabilities, including some paralysis in her upper limbs. She can walk, but she has something called gait ataxia, which means that she is unbalanced, so she can't walk for very far before she starts to fall. So she needs a wheelchair to go long distances. She has some vision loss. She has some hearing loss that requires something called a cochlear implant, which has been very successful for her and has allowed her to keep up with speech, keep up with peers with her speech. It also has affected her medically and leaves her open and vulnerable to really typical childhood illnesses, but also, definitely something like COVID. Her chest wall is really weak and she cannot cough and kind of clear secretions and things like that, like normal children would. So things like that and fever can be really, really damaging to her in the long term. So even if, we're not talking about something like death, it could really affect her and take away some of the strength that she's gained over these past 5 years since her diagnosis. But in spite of all that, she is a cognitively typical child. So there's no cognitive deficits with RTD, and which is such a blessing, but is also a really big challenge sometimes for us as her parents to make sure that she is getting everything she needs to navigate this world, and make sure she's getting all of her needs met while being safe, both physically, making sure she's safe. She split her chin open, unfortunately, about a week ago, just kind of walking around our house. She tripped over her sister's foot and hit the floor and split her chin open. It happens. But, we have to do our best with her just out in the world, making sure she's safe. And that includes in school. And we're not able to give her the resources she needs in any sort of homeschooling environment, while meeting her cognitive needs of a typical first grader. So this entire thing dealing with COVID, starting back in 2020, very quickly became apparent that this was going to be very difficult for us because of all of the resources that we are given, and all the opportunities that she has between OT, PT, deaf and hard of hearing services, and things like that. As long as she has a one-to-one para, because she needs help with everything from eating to using the restroom to getting in and out of her wheelchair when she needs to do that. So, she needs help with every single thing along the way during school, from getting her markers out to taping a piece of paper down on the desk so that she can color or do whatever she's doing. So doing something like virtual school was just not going to be an option for us. And that has continued to present issues. So to not have something like a mask mandate in place where everyone's wearing masks to keep her safe was just a really scary proposition for us going into this school year.
Well, thank you for sharing, and I'm very glad that we can help Ellis and all the other kids. I'm moved by what you've said and what the doctor has said. About and I'm a big believer in personal responsibility, but the limits of personal responsibility. We wouldn't need speed limits if everyone drove responsibly, but that's not the case. And here, I understand there are disagreements about things, but the thing that we need to remember is the science is clear. There's not a large group or even a small group of reputable scientists saying that masks cause COVID or wearing a mask causes some other irreparable harm or long-term problem. It's a minor inconvenience to save potentially your life and the lives of people around you. Let's open it up to questions, and let's do that by raising our hands. And so the first question is from Steve Pickett. Steve?
Judge, two questions for clarity. What's your expectation with this injunction for schools and for businesses? Is there enforcement arm that you'll be using regarding your order initially? And number two, you say that this is about a victory for the humans of Dallas County against the virus. Talk to me then from your vantage point on that human in Austin named Governor Greg Abbott and his order that was counter to what you just won in court today.
Okay, so taking the last question first, I'm hopeful that Governor Abbott will look at what is happening in our area and throughout the state. Today, Steve, once again, in a 19-county area, we have 0 pediatric beds available. So if your child needs a pediatric ICU bed that is staffed, let me explain that, by the way. People say, well, why don't you just go buy some more mattresses and put 2 beds in the room? When we talk about beds in medicine, we're talking about a staffed unit. The respiratory therapists, the nurses, the doctors, everyone necessary to staff that unit that we call a bed. We don't have any units for your child right now in a 19-county area. You may have seen that in Hood County, which is within that 19-county area, they were flying people to Idaho last week. That's how serious this is. So my hope is that we will all take off our red hat and our blue hat and put on our human hat and listen to the doctors, because this is for our community, for our state, It is like we have had a diagnosis of a serious illness. And whereas you might look on the internet for some herbal supplements to help you with your cancer, if that's what you want to do, you better listen to the oncologist if you want to have a chance of battling your cancer. And the doctors in this case are the infectious disease doctors, like Dr. Wong and Dr. Septimus and Dr. Pearl and the doctors at the CDC. And they're all saying the same thing: wear a mask and get vaccinated. So that's what I hope happens for all of us. As far as enforcement, we never had a fine for schools. We expect schools to follow the law. The law is you're required to have masks on your campus now. The TEA has flipped their position. They no longer will stand in the way of people following that law. The judge has just said that is the law here in Dallas County, and we expect that will be followed. I removed my business fines after the first Supreme Court order. We will look at what needs to happen there. Good businesses should not need the remote possibility, because there's just not enough enforcers to go around, right? But the remote possibility of a fine to follow the law. Now that likely will be reinstituted in short order, but hopefully we will be following the law and doing what we can to protect, our fellow citizens. And what I would say to businesses out there and everyone else out there is, if people don't like it, blame it on me. If your employees appreciate that you're doing things to keep them safe and to keep your business thriving, so they can not only keep their job, but also go home safe to their family, take credit for it yourself. I don't care. Let's just get it done. Let's mask up. Let's save lives. Next question, Matt Howerton.
Yeah, Judge, just want to ask you real quick. I know that you removed the enforcement capabilities from your order whenever, the Supreme Court of Texas came and sided with Governor Abbott. What does this do, basically, the temporary injunction here? Mainly, how can it aid the county in your mandate? Does it provide any fuel for schools in their litigation against Governor Abbott? What does this mean? Can you explain it to us like I'm a seventh grader?
Sure. So for the schools, it is another strong argument, another court saying, once again, as every court that's looked at this over the last however many days, and the AG was telling me yesterday they have 6 more of these hearings in other courts this week. But every court that's looked at it so far has said that the harm of not allowing mask mandates is irreparable and imminent and must be enjoined so that we can have those. And you've got another court saying it now. And Matt, I think I have forgotten the other part of your question, so I apologize.
It was mainly just, how does this, kind of fuel, your situation, or how does it help the public situation? Because is this just a court win that's just going to eventually get struck down? How do you guys use this to better the message here, which is please wear a mask?
So this puts us in the situation that we were in before the Supreme Court's first order. Okay. So you have what you have right now as a school or a business is you have the law telling you, the unequivocal law in Dallas County telling you that you must have a mask policy that at a minimum requires the universal wearing of mask on your premises. And you don't have any longer the TEA saying they're going to enforce, the Texas Education Agency saying they're going to enforce any component of GA 38 against a district. And you don't have any concern on the part of business of GA 38, the governor's order, impeding you from following the local law and requiring masks in your building. Steve Dial, I'm just kind of going down the line here.
Judge, really quick, do you realistically, this is two-pronged like everybody's question, do you realistically think that once it moves on from here on appeal that anything's going to change? And I know you don't want to talk about politics, but the court is political, like it or not. Do you think that this will be the law of the land passed today? And then secondly, aren't businesses in Dallas County just going to get frustrated today? Oh, I need to tell people to wear their mask because that's the county order. Tomorrow it's on appeal, so they don't technically have to wear it. Now it's in the Supreme Court. Like, isn't it just going to create more frustration?
Okay, the first part of things being political, we live in a political world, but at the same time, courts are to look at the law, and we believe that the law is pretty strong on our side in that it gives the governor the authority to suspend certain regulatory laws, like the law to get a license to be a nurse in Texas that is different than the license in other states, to spend that so we can get more nurses in to help us. But it's not a regulatory law that when county judges and mayors respond to emergencies. What the governor is seeking to suspend is not a regulatory law. It is the response to a disaster. And so when we think about politics, the thing to remember about politics is public opinions change, right? And right now what the governor is looking at, and it's pretty clear that that's what he's basing his decision on, is polling samples of likely Republican primary voters and donors and what they want him to do right now. But as we get more and more people, and I don't want to see that happen, but as more and more people get sick and they don't get the medical care that they need, and we move into our mass critical care plan, those things can change. And so as we all look at this, if we want to look at it from a selfish perspective, we need to think not about what people want to hear today, but what is the right thing to do for today, so that those who make those decisions will not be judged harshly tomorrow or next year. And I'll go on to Lynn Ann. Go ahead.
Hi, Judge. Thank you. And this may have been partially answered already, so I apologize. But so this is just one victory in what could be potentially a lot of back and forth as things move through appeal in the Texas Supreme Court. What do you advise businesses in Dallas County to do? Can they legally keep their mask mandates in place throughout all of this back and forth?
They legally can. Two things on that. As a business, you have the ability, just like you have the ability to say, wear shoes and a shirt in my restaurant or my business, you have the ability to require people to wear masks. And currently, that is the law, not just a suggestion, it's the law. And if the law changes, that doesn't change your ability to do it. And you're seeing why it's important. People feel that they're invincible. Some young people feel they're invincible. Some old people feel they're invincible too, and everything in between. But the reality is people are not. And as we just pointed out, in a 19 county area, not Dallas-Fort Worth, but a 19 county area spanning 100 miles on, in different directions, there's 0 pediatric ICU beds right now. And kids have generally a better course of COVID than adults do. And I think we're down to about 16 in 19 counties, maybe more than that. One of my staff may have the latest numbers, 16 yesterday, it may be up above that now. Staffed adult ICU beds. That shows you the serious nature of this and why all of us, we can't do everything, but as business owners, we can all do something. And the something that you can do right now is require people to wear a mask, which is also following the law, because the life that you protect may be your own or your employees, and the profits that you protect certainly will be your own. Charlie Scudder.
Yeah, thanks, Judge. So I'm wondering, because I know you amended your order once we got the TRO Supreme Court ruling to remove some of those penalties. Are you planning on giving an update to that order to add those back in, or are you planning an update at all, I guess?
We'll look at updating that order. I'll get some input from people, and we'll have some information on that. Josh Fechter.
Thanks, Judge. So just outside of the mask mandate victory for y'all today, but kind of looking at sort of the broader court battle, in sort of their plea to the jurisdiction in Dallas County and across Texas, the governor and the AG have argued that they can't actually enforce their rulings, basically that they would not be the ones that would say fine you for violating the ban on mask mandates, that basically that authority would lie with the DA. And I wanted to know, and this can be answered by any sort of lawyers who are on the call too, is that true? And two, for you, Judge, what do you make of them saying, something in public that they're going to go full tilt at, fining all of these folks who are violating this, and, in the courtroom saying that they can't actually do that?
Man, I don't know. Whatever we have to do to keep people safe, somebody wants to come after, me, find me, whatever, then that's what'll happen. But I'm focused on listening to what the doctors are saying, doing what I can to keep people safe, keep as many kids in that in-person school experience without a big COVID outbreak. That's my focus. I can't honestly tell you I've given it a minute's thought what these folks are going to do to me. Fernando, you're next. We kind of almost have to play lightning round to get me to my next one.
About 20 minutes ago, the governor issued another executive order prohibiting local governments from mandating vaccines. Is this something that the county is exploring in any capacity? And when you talk about listening to public health officials and medical experts, the generals you call them, what do they say about a vaccine mandate?
Well, I haven't had a chance to read the governor's latest order and the breadth of that. I will say this: in the past, the Republican Party has prided itself, whether true or not, of being the party of local control and being the party that claims to be pro-business. And it is just a bizarre situation that currently the governor, and no one in his party is challenging this, is saying, we don't want there to be local control. We want everything to be decided by big government in Austin, a one-size-fits-all situation, whether you're completely out of pediatric ICU beds or whether you're in a county with 1,000 people and everybody spread out on a ranch and not around each other. We don't care because we want to be in control. But not only do we want to be in control of local government, apparently we want to be in control of business. So we want to tell businesses what they can and can't require from their employees. And we've always had a history of businesses being able to require things from their employees as a condition of employment. For instance, you got to have certain shots to go back to school, right? And so to pass orders that hospitals and airlines and common carriers and others who want to protect their customer base and their employee base by making the decision as a business how they want to proceed with vaccination is the opposite of being pro-business. It is basically being a nanny state to tell people, not that they can't do something in their best interest because it's better in the short political run for elected officials in their polling to restrict them from doing that. And I think that is a very dangerous thing and something that may awaken people who currently think that they, support the governor's policies or support the Republican Party into really rethinking that as they get more and more intrusive into business. I saw Charlotte had a hand up, and she can be our last person if she's even still there, because I got to run to another meeting.
Yeah, thanks, Judge. Actually, Fernando asked the exact question I was going to ask, so we're good.
God bless y'all. Appreciate y'all. Everybody's going on a little bit less sleep than normal. I know you guys are too. I don't know, this may be live. It looks like it is on Facebook too. So I'll just say to everybody, all of y'all, like I say to our first responders, to stay in this fight. And it's not a fight against Governor Abbott, it's a fight against the virus. We got to stay in there and we got to finish it. And the way that we do that is we take good care of ourselves. So I hope everybody out there is taking good care of themselves. If you're a first responder, you can recite this with me by getting plenty of sleep, eating right, exercising, spending time with people that we love, laughing out loud every day, and looking at everything through the lens of gratitude, because that opens up possibilities to solve these problems. And so I hope you're all doing that. And I hope the public's doing that too. And I hope everyone will renew, their spirit of camaraderie and concern for one another, both in masking up and in recognizing that people that disagree with you about this issue or any other issue are deserving of the grace that has been extended to you by others. We want to extend that to them as well. And just remember, our